Hi, everyone. This is Drake Behrakis, Chair of the National Hellenic Society, with a special NHS Excellence Series tonight with Dr. Elaina Manolis. We'll be talking with Elaina about her background, the field that she's in, and what work she's doing today, and about things that she's passionate about in her life as well. She's one of our best and brightest NHS members, and so it's a privilege for us to have her join us tonight. So thank you, Elaina. How are you?
I'm good, Drake. Thank you for having me.
Oh, our pleasure, our pleasure. So, why don't you tell us a little bit about your background? Where you came from, a little bit about your Greek family growing up, and then we'll take it from there.
Sure. So I'm actually born and raised in Albuquerque, New Mexico. I do have a large Greek family back there. Grew up, went to school through grad school there, but then I happened to met a guy in Drake, Massachusetts. So after I graduated school, we ended up getting married, and I moved up here just about 6 years ago to the day. And I have been here since. I'm a practicing physical therapist, and most recently, a full-time faculty member in the Northeastern physical therapy program.
So, how was it? Tell us a little bit, because obviously we're here. We're obviously we're biased to some extent with our Greek communities up here, being some of the oldest in the country. But tell us a little bit about the growing up in Albuquerque and the Greek community there.
It was quite a shock moving up here and seeing just how many Greek communities there are, not only just in Massachusetts, but in the New England area, period. Where I come from in Albuquerque, we have one Greek church. We have a smaller Greek church in Santa Fe, New Mexico as well, but that is it. And it was such a wonderful upbringing because it was one church. So there was a whole sense of community. All of our parents grew up together, and therefore all of the kids grew up together. And those are not only a lot of my cousins and family, but some of my best friends as well. So a really tight-knit community. And it's just really nice Pare every time we go back, and now all of them are having kids too. So it's just kind of carrying on the traditions of being such a tight community.
And tell us about how you got into the field of physical therapy. Was it something while you were in college that's something that piqued your interest, or was it something you had thought of beforehand? Tell us a little bit about how you kind of steered in that direction.
Sure. So my siblings are triplets, and when they were born, I was 3 years old, and my parents were like, "We've got to get one of these kids out of the house." So they put me into dance. So I have been a dancer since I was 3 years old. So I've always loved that aspect of movement and just how the body works and things like that. There was an incident when I was about 15 when my siblings and cousins were in a pretty bad car accident. And one of my cousins had to have emergency brain surgery. He was young. He was probably 13 years old. And I happened to be staying in Dallas at the time, where he's from, and got to attend all of his physical therapy sessions while he was in the hospital. And after that, I just knew that was exactly what I wanted to do. So I feel very fortunate that I had the path I wanted to go on at such a young age, because I know sometimes things change, but I've pretty much been steadfast on that since then.
And then that led you obviously to at some point decide that you need to go on further and get your doctorate as well. Were you thinking at that point, were you specializing at all? I know obviously you have, I guess you can talk a little bit about it later on, but with, your experience with dance, I know that's one area that you focus on today because you have a great understanding of it, not only as a performer but also as a physician. So, what steered you to go grad school? Was it essentially that's the career path you needed to take you to the next level? And at what point did you start specializing in certain areas of physical therapy?
Sure. So physical therapy programs now across the country are doctorate level. So they're grad programs, most typically a 4-year undergraduate degree, followed by somewhere between a 2.5 to 3-year graduate degree program. And so that is the degree. It's a doctorate of physical therapy. And once I graduated with that, my first position was at a skilled nursing facility in Lowell. And I had spent several years there and actually became a rehab supervisor as well as a practicing therapist. And so I sat for my board certification in geriatrics. And then I still had this passion for treating dancers and being in the performing arts. And so I've actually now switched paths and I'm more in the orthopedic section of physical therapy and got board certified there. So in orthopedics as well. So really, it was about 3 years after I got my doctorate that I decided to start specializing. And then it was after that that I actually just completed in May my terminal academic degree because I also always wanted to get into teaching. And so I felt that that was the right path to go down.
And we'll talk a little about that in a second. As part of your growth, going from your bachelor's to your doctorate and getting the experience here, is there also any clinical or research component to that, or is it strictly all practice, seeing patients, training, those types of things? Tell us a little bit about the field.
Sure. So, a doctorate of physical therapy. I mean, this is why I love the field of physical therapy because there are so many avenues you can go in, and it's just you don't have to be landlocked into just one type of setting or treating one type of population. So it's really never boring, and you can always continue to further yourself, whether it's just as a clinician or as a researcher or as a faculty member. So there's just so many avenues within physical therapy. And but the doctorate of physical therapy is a clinical degree. So most therapists are doing pretty much clinical work. But that's not to say that they also don't partake in research opportunities that come up, especially in some of the big institutions that are also teaching facilities. They will always have some research ability within that that therapists can get into. So there's a lot of avenues.
So you went from working in Lowell to eventually making your way to Boston. Tell
Yeah.
us about that as you gain more experience, obviously exposure, and you worked for some pretty impressive organizations like Spalding Rehab, and as you mentioned, Northeastern. You're also teaching there. So tell us how that evolved and give us a little more details about those.
Sure. It's funny because when I first graduated, I had my head set on I was only going to treat athletes. I was only going to be in outpatient orthopedics. And what I learned from that is you just can't pigeonhole yourself because you never know where your path's going to lead. And so at that time, I did end up in the subacute setting and loved it very much. But I did eventually see where I wanted my future to go as far as the population I wanted to treat and where I wanted to end up professionally in the academic field. So I did. I had the opportunity to meet several therapists, clinicians in the Spalding program at a conference I attended, and it just so happened there was a position available, and that's kind of how I ended up there. Very reputable institution. I'm very proud to be a part of that. I
Absolutely.
still treat there one day a week. So I can, and I'm very grateful that I can still do that because I think that that's a big, and I know you said we'll get into it, but I think that's a big plus when you're teaching is to still be in the field practicing.
Absolutely, absolutely. And obviously, we could talk about the dynamic of leading up to your work and experiences. Obviously, before this whole COVID pandemic stuff hit, and how things have changed right now. But tell us a little bit how competitive. I mean, obviously, people are as you mentioned, it's not just PT for injuries. It's or for people that have gone through major surgeries. It's there's the athletic component, there's a performing component. People do it for everyday activities that will they'll need support. So as the field has grown, and obviously you're in a tremendous marketplace here in Boston.
Mhm.
Tell us about the competition level. Is there are there a lot of people fighting for a lot of positions? Is it pretty wide open? Again, Boston being a huge hub of obviously medical institutions and educational institutions. But tell us a little bit about the field itself and how crazy it is, kind of behind the scenes, so to speak. I mean, we know there's somewhat of a nursing shortage. There's been one for quite some time up in this area of the country. But give us a little bit of, I guess, a little color on the field itself, and obviously as a young professional in that field, also maybe lending your kind of experiences into those girls or boys or in high school, even college that might be thinking about the field, and tell us about how those opportunities are there today or not actually. So, yeah.
No, sure. So there's always a need for physical therapists. And so I would not necessarily that there's a shortage, but there's always a need. And I think the biggest issue or reason that there's such a need is most states now have what's called direct access. So for a very long time, physical therapists could only treat under the order of a physician. But now with direct access, and it is up to, it varies per state, but most states allow it, and then it varies per institution. But as of now, direct access means a patient can literally come off the street and come right into the clinic, and you be the first clinician that they see. And so with that, there is a greater need for physical therapists, and particularly those with specializations, to be able to field some of that comes in the door if you are the first clinician to see them. And that's why the program is very rigorous as well, because your knowledge has to be pretty expansive to triage some of those patients that are coming in the door. So I would say, as far as the job market, there should be plenty of opportunity. Where the competition lies, especially in this area, is getting actually into the physical therapy program. There's a lot of PT schools in the New England area, far less kind of spread throughout the rest of the country, but getting into the schools are pretty competitive, especially because it's a doctorate level degree now. So, grades are always important when applying to the program. Maintaining a high GPA, volunteer and service is very important. Leadership opportunities are important. All of those are important to put onto your CV or resume when you're applying to the program. And actually now there's a pretty high regard for having at least some exposure to scholarship or research. So whether that's you're able to be a research assistant in an undergrad program, or even just collect data for somebody who's conducting a bigger research project, those are all things that are pretty highly looked upon when choosing applicants.
Sure. Is there one specific area or subset of just the broad umbrella of physical therapy that seems to be either growing quicker, or is it essentially just across the board?
There's always more therapists in the orthopedic realm. That's going to be the most popular for sure. But with the American Physical Therapy Association now having many specializations across the board, with whether that's cardiopulmonary or neurologic or geriatric, the field is definitely expanding. And so therapists are definitely finding their niche. But I'd say overall orthopedic is the most popular.
Got you. And how was the transition to, obviously you had a little bit of experience teaching, but now that you're teaching full time, tell us a little bit about that transition, how it's been. I think you started as a part-time instructor, probably, I think during COVID, correct?
Yes. Specifically at Northeastern, yes. I have been doing some adjunct faculty work at the UMass Lowell as well as
Sure.
Northeastern for a couple years, but I am now full-time faculty at Northeastern, and it's been a big change, but it's been an excellent change. And I think even more so now post-COVID, because there's, I think what a lot of schools have found is that PT school doesn't quite work fully online. I think there are quite a few programs that go the hybrid route or the flipped classroom route where it's not all 100% in person. But I think COVID really showed, just observationally and even objectively with students coming back, whether it's missing out on learning some of those soft skills that are important before going out into the clinic, or even just their performance in general, that there needs to be a large component of face-to-face work. So that's been really fun to kind of delve in and try to see what some courses we can make some changes to make things a little bit stronger as we kind of move forward. So I think COVID actually did kind of shine a light on some aspects of PT programs in general, but where we can really kind of tweak things to make them the most optimal.
Sure. What are you teaching this fall?
So this fall, I am just about to wrap up here in a couple of weeks with cardiopulmonary, but I will be moving into geriatrics and musculoskeletal in the spring. So a little bit more aligned with my experience and specializations.
Sure.
I'm also
Go ahead. No, go ahead.
I'm also mostly working on clinical education. So I am, me and 5 others are the clinical educators who try to place all of our students for their clinical rotations,
Okay.
whether that's within the Massachusetts area or across the country.
Okay. And tell us how technology, through your experiences, how has technology impacted your field, primarily over, let's say, the last, decade or so, while you've really been, been
Yeah.
working through either through Spalding or Northeastern or even up at UMass Lowell.
Yes, it's incredible how things change and more things come out even by the month now. I think COVID again really kind of pushed that. But for the field in general, we have now kind of taken on, especially during COVID, more of this telehealth realm, which is great to some extent. But I think there are some pretty significant limitations with that. It really depends on the patient population, and it's different if you're just checking in with a patient versus actually trying to perform a complete assessment. So there are some pros and cons with that. And though it is important to be able to have that skill through the computer, because as I said, I think, most programs are moving and the profession is moving into somewhat of a hybrid situation at one point or another. So being able to communicate effectively through the screen is important. And, we've just been able to use so many aspects of technology, whether it's Zoom or Teams or discussion forums, just even interactive applications, especially for things like, I was tasked with teaching cadaveric anatomy, where we're usually dissecting cadavers in person, but in the summer of 2020, we had to make that virtual. Every program did. And so we really kind of, it was really nice. All of the anatomy instructors within Massachusetts kind of came together and shared either tools that they've used or programs they've become familiar with that can make that a little bit smoother. So though I don't really want to do that again, we did make it work. And there are a lot of options out there actually for effective teaching.
Oh, great, great. And are there any, I guess, anything specific that through technology that's been, I guess, for the field that's really been, I guess, transformational? I mean, there's always technology changes, there's always updates, of course, but I guess talk to us a little bit about if, and maybe it's been gradual technology, but has there been anything over the past, let's say, decade that has really kind of like changed the field or really refocused the field at all that in your experiences?
Definitely. I mean, as you said, things are kind of evolving at a rapid pace, but I think the biggest thing where technology really comes into play in the field is particularly for limb loss or spinal cord injury recovery. There are so many options now for teaching how to walk or even just perform like a sit to stand out of a chair. And all of of course it ranges, but there are now a lot of amputees who have options of Bluetooth technology for, their new limb. And it just allows for return to whatever activity they were doing before and just improving their quality of life that may not have been around, and certainly not a decade ago. Sure. And I think, Spalding really is in the news quite often for their assistive technology and things that they just kind of, their robotics that they come up with.
I know it's somewhat earlier in your career, even though you've got your doctorate degree, you're teaching, you've had a lot of clinical experience, but, where would you see yourself? Where would you like to go with this? Obviously you've come quite a ways and you've made a huge commitment, an investment in obviously educating yourself and training and getting these various experience. But, is there, I guess, a kind of goal in mind that you'd like to see yourself at, whether it's in 5 or 10 years, or is it just, seeing how things evolve and being flexible and as long as this is, obviously important and you're passionate about it, that you continue to kind of follow that path forward. So.
Yeah, I always had my sights set on being an educator. So I really kind of see myself as the years go by, just kind of remaining active in teaching, kind of working my way up in whatever capacity I can, as well. I really enjoy not only the educational piece, but the leadership piece and being able to influence and teach, the upcoming therapists who are the future of the profession. And I think that's really important to maintain engagement and excitement. And I feel like that's a strength of mine to, while I'm teaching, to be able to impart that on others. So I still foresee myself practicing. Again, maybe probably at the capacity that I am now, at just about
Sure.
20% of the time. But because I do feel that is extremely helpful. It keeps you relevant. It provides real life examples to draw from when you're teaching. And so, though I want to focus the majority of my time on teaching, I still want to be a practitioner.
So you fell in love, and you moved up to this area. We're gonna get a little personal, but
We really
yeah,
switched around there.
yeah.
Yeah.
Well, we have, of course, the biggest question I'm sure people are going to ask after viewing this is, all right, you're from Albuquerque, New Mexico. You did studies a little bit in Texas.
Yeah.
Obviously, your husband's from up here, so you came back up here. But I guess, what was what was the trigger? Did you meet him down there? Did you meet him up here or somewhere else? I mean, you don't have to get into the
No,
details,
no,
but
yeah. No, everybody asks because they're like,
yeah,
how did you end up literally across the country? No, I met Ilya in Albuquerque. His dad has some family that is in Albuquerque that, again, I talked about that one Greek community I've grown up with my
sure,
whole life. And one of my best friends is one of his cousins. And so we met at their engagement party, and that
that was
actually,
it.
that was pretty much it. Then we attended a Sons and Maids event. Actually, it was held in Vegas that year. But after that, that was pretty much settled. And when I was going through PT school, choosing my clinical rotations, I was like, you know what, I better get a couple up in Dracut, Massachusetts, and make sure I can handle the weather.
Yeah.
And of course, I did those rotations in the winter of 2014 when I think there was 10 feet of snow that season. And I just remember my mom calling me and being like, where have I sent you? So, but I told him, I said, man, if I can stick through this, I think we're good. So,
Well,
yeah.
I think you've definitely excelled. There's no doubt about it, and
Oh,
so
thanks.
it's been a pleasure having you this evening. Before we wrap up,
Sure.
we're also going to share a little bit of a personal experience of yours. We're upon the Thanksgiving season, and for those across the country that obviously are doing a wonderful different things. You mentioned volunteer and service. Your husband's family has been doing some really, I guess you can't even put it into words what they've done over the last couple of decades up in the northern Massachusetts area and beyond in terms of their volunteer and service and giving back during Thanksgiving. So tell us a little bit about that. Obviously, you weren't there early on, but it's something that you came into getting married to the family and seeing how they one of the many of things that they're doing in terms of giving back to the community, not just the Greek community, but community at large. So tell us a little bit about Thanksgiving every year in the Manolis household.
Sure. Yes, I feel very blessed to have been able to become a part of this family and thus become a part of this project. So through the Manolis Family Foundation, they host Project Helping Hands every year. We just wrapped up today our 28th year. So I have now been a part of 6 of them, but they started out with just serving about 30 families and compiling everything they need to make a Thanksgiving meal. So we don't cook the meals. We provide the turkey, the stuffing, all the sides, the vegetables, and really just to allow the families to have their own Thanksgiving and create their own memories. It started out with, I think, them putting together 30 baskets for 30 families. And today we wrapped up serving over 2,200 families of 4 to 6. So it's incredible philanthropy. We couldn't do it without volunteers and many of the donations that we get, certainly last year, but especially this year with the supply chain issues and just kind of the state of supplying food and things like that. We were very grateful. We were able to get all of the product and have enough volunteers on Sunday to help package everything, and then enough volunteers today to pass it all out and do the delivery. So it really is a nice way to kick off the holiday season, particularly Thanksgiving, knowing that, those families are going to be able to have a Thanksgiving.
Wonderful. Well, with that, I want to thank you again very much for joining us this evening. I'm sure we'll get, once we post this up on our social media and our membership and families and beyond get a chance to see you as part of our excellence series. I think there'll be a great story that they'll understand and hear from you, and hopefully be inspirational as well to young girls and women that are looking to get into your field. Again, thank you very much. Have a blessed and happy Thanksgiving to you and your family, and really appreciate again doing this for us. Thank you.
Thank you for having me, and happy Thanksgiving as well.